That's an excellent question. We don't we don't have all the answers in terms of what causes ADHD, but we do know that it's very strongly genetic. We know that there's roughly 5 to 6% of people that have ADHD, and that doesn't change very much regardless of what country you're in, what the cultural background is, or whether it's people 100 years ago or kids nowadays. Obviously, there's, the world changes, and there's probably less tolerance for some of the behaviours which we now diagnose with ADHD compared to the past. But some of the evidence that points towards the genetic cause of ADHD is, so we've got twin studies, and we know that there's identical twins and non-identical twins, and identical twins are genetically identical, and we know there's about a 92% rate of one twin having ADHD if the other does. We also know that ADHD is much more common when there's minor genetic abnormalities in a person's makeup, which we can test, even if we don't always understand exactly what those abnormalities are associated with. And it's very common that if a child has ADHD, that a parent was similar, but that doesn't mean that it's always the case. And ADHD can certainly occur out of the blue with with parents that weren't at all affected by the condition, and one child can have it without anyone else in the family having it. There are also environmental factors, and things like alcohol or drug use in the pregnancy, prematurity can have a higher risk, early infections, early environmental factors to do with the upbringing of the child, like significant abuse. So other things are also implicated.